On the 26th and 27th of April, junior doctors will be taking strike action against the Tory government over a new contract which, if implemented, will constitute a serious attack to their pay and conditions. As ever, the issue's bigger than the British Medical Association or medicine as a profession. It's about how, as a society, we look after ourselves. It's about holding our ground so better care, which is universally free, democratically organised and fully socialised, remains imaginable. We're all affected by the junior doctors dispute. The new contract will increase the shortage in doctors and will endanger our care. It will allow further privatisation, undermining what should be a universal healthcare system run by doctors and patients for the public good. The government have stopped negotiating and have declared that they'll impose the new contract, disregarding doctors and the public, who polls show are overwhelmingly supportive of the junior doctor struggle. Let's force the issue. Conservative MPs enthusiastically support private healthcare and the feeling's mutual. A large number of MPs have shares or hold roles on their boards. Former Health Secretary Andrew Lansley went straight to work for them after leaving his cabinet position. Jeremy Hunt, his replacement, and the man you will have seen blatantly lying about the contracts for the past few months, wrote about his ambitions back in 2005. Our ambition should be to break down the barrier between private and public provisions, in effect denationalising the provision of healthcare in Britain. Since the Health and Social Care Act of 2012, over a third of contracts have been awarded to private healthcare firms. 40% of contracts from clinical commissioning groups set up by the government to get doctors to tender clinical services with no experience have gone to private firms. Outsourcing and independent healthcare providers run by venture capitalist groups are very excited about what is going on, as they stand to make massive profits in the face of declining standards of care. So far, despite massive public support, it's been the junior doctors picketing their own hospitals, with solidarity on picket lines themselves. It's time to escalate and join the dots. We'll be targeting the biggest private healthcare providers on the 26th and 27th of April, saying, hands off our NHS. We are calling for a mass picket of the outsourcers and private healthcare providers that make the future of a democratic and universal healthcare harder to win. Join us in one of the multiple actions taking place across the country. If there isn't something planned in your area, get in contact and we will help you set up your own picket. Virgin, Serco, Care UK, Spire, Alliance, BMI, GHG, back off. Solidarity with junior doctors. #Picket Profiteers.